Hi everyone, my name is Leah Crown. I'm the Director of Health and Human Services for the City of Meriden. It is time for our social media question and answer video based off of your questions this week that were posted on the City of Meriden Facebook and Instagram pages. So as you are aware, COVID-19 is a rapidly changing situation. The answers to your questions today are based on the Center for Disease Control and Prevention guidance, the Governor's executive orders, and general COVID-19 knowledge as of today, May 5th, 2020. So we received 7 questions today. We did have a couple of questions regarding when school is opening, and as the questions were coming in, the governor actually announced that school is canceled for the rest of this school year. So I'm not going to formally answer that question. That is the answer for you. So the first one is, where can I get a thermometer? So thermometers, like toilet paper, are really difficult to find right now. We would suggest looking at some online retailers to see if you can order one online. If you purchase an oral thermometer, it is recommended that you do not share it with others, and please clean it with soap and water after every use. So number 2, is it safe to have tag sales at my residence? We're all doing a lot of quarantine cleaning right now. At this time, the health department would not recommend having a tag sale. It is not recommended to have any unnecessary visitors to your home. The message is still stay home and stay safe. Our third question, on May 20th, will softball fields be accessible for practices? Obviously, there will be strict rules in place in terms of numbers of kids and coaches present. So I did reach out to the Parks and Recreation Department. I don't have a specific answer to this question right now. The governor's office should be releasing further guidance on team recreation and social gatherings as part of the Reopen Connecticut plan, so please stay tuned. Number 4, any update on the landfill reopening? So Public Works is evaluating current transfer station operations during the partial openings for leaves and brush, and will open full operations as soon as safe usage by the public can be assured. Number 5, with the number of cases increasing, likely because more testing is available, but hospitalizations are decreasing, does that mean percentage of severe cases is drastically lower than originally displayed? So I guess two parts to this question. So yes, one, the number of cases are increasing, can be attributed to more testing, as well as the release of a standardized case definition by the Council of State and Territorial Epidemiologists for COVID-19. So now, based off of that standard case definition, cases can now be classified as confirmed or probable. Hospitalization numbers have been decreasing in Connecticut for about the past 9 days. This is a wonderful first sign that people who are getting the illness may not be sick enough to go to the hospital and are able to care for their symptoms at home. Case numbers and hospitalizations numbers, as we say in public health, are a snapshot in time, right? Public health, we're going to continue to watch hospitalization numbers and the resulting impact on efforts to flatten that curve. Number 6, will Meriden residents get an antibody test? So we get a lot of questions about antibody tests, and the data regarding these tests is changing day to day. So the current information on this is the CDC has developed a laboratory blood test to assist with efforts to determine how much of the US population has been infected with the virus that causes COVID-19. The CDC is also using its serologic test, which is that antibody test, to evaluate the performance of commercial antibody tests. The Food and Drug Administration is in the process of approving several antibody tests that have applied under what's called emergency use authorizations. So an antibody test, what it does is it looks for presence of antibodies, which are specific proteins made in response to an infection. Antibodies can be found in the blood of people who are tested after infection and show that people have had an immune response to the infection. Antibody test results are especially important for detecting previous infections with few or no symptoms. However, public health does not know if the antibodies that result from the COVID-19 infection will provide someone with immunity from a future infection. If antibodies do provide immunization, we do not know what titer or amount of antibodies would be protective or the duration that protection would last. CDC scientists are currently conducting studies to better understand the level of antibodies needed for protection, the duration of that protection, and the factors associated with whether or not a person develops a protective antibody response. So the CDC serologic test has been designed and validated for broad-based surveillance and for research purposes to provide information needed to gather, to guide the response to pandemic and protect the public's health. This test is not currently designed for individual use, i.e. to test people who want to know if they have been previously infected with the virus that causes COVID-19. So it's a very long answer to your question. I guess the short answer is at this point there is no plan that I am aware of to do widespread antibody testing in Meriden. Number 7, if you don't go out of your home and no one has come into your home, do you still need to disinfect daily? This individual notes that they're running out of the wipes. Cleaning with soap and water reduces number of germs, dirt, and impurities on the surface. Disinfecting kills the germs on the surfaces. So I did a little research on the CDC website, and if you do not leave your home except for essential errands and you have had no visitors into your home, you can reduce the frequency of disinfecting with your wipes. If available, you can use an unexpired bleach solution as a disinfectant, and the instructions for that are on the CDC webpage. We would continue, though, in public health to encourage you to continue your frequent hand washing and avoid touching your face with your hands. So those are all the questions that we received this week. I encourage all Meriden residents to please continue practicing social distancing, wearing your face cover when you need to go out in public, wash those hands, and avoid the crowds. I also want to take the opportunity to recognize that it is Teacher Appreciation Week, so thank you to all of our teachers and educators, and it is also National Nurses Week, so a big thank you to all of our nurses. We know how hard everyone works to keep our children engaged and educated during this difficult time, and how tiresome our nurses work to take care of those who are ill, and how tiresome they work to try to keep the healthy people healthy. So from everyone at the Meriden Health Department, thank you.